Welcome to this lecture on forensic toxicology, understanding amphetamine. Amphetamines are powerful central nervous system stimulants. Medically, they are used in the treatment of attention deficit hyperactivity disorder, or ADHD, and narcolepsy. However, when misused, amphetamines can cause severe health risks, including fatal outcomes. In forensic toxicology, these substances are frequently encountered, both in clinical cases of overdose and in postmortem toxicological investigations. Amphetamine can be administered through multiple routes, including nasal insufflation, oral injection, or intravenous injection. Once in the body, it undergoes hepatic metabolism, converted into compounds such as hydroxyamphetamine and benzoic acid. The drug and its metabolites are then excreted in urine, sometimes unchanged, or as processed metabolites, which is important for toxicological screening. Amphetamine acts as a potent CNS stimulant. It enhances neurotransmission by increasing the activity of serotonin, dopamine, and noradrenaline in the brain. Additionally, amphetamine inhibits the action of monoamine oxidase, the enzyme responsible for breaking down these neurotransmitters. This leads to higher level of monoamines, causing heightened stimulation, alertness, and euphoria. This table compares amphetamine and methamphetamine. While structurally similar, methamphetamine is chemically more potent, longer lasting, and more toxic. Methamphetamine has a higher potential for abuse and is often known by street names such as ice or crystal meth. Both drugs can cause significant health damage, but methamphetamine is often associated with more severe psychiatric and neurological effects. In acute amphetamine toxicity, the most affected systems are the central nervous system, cardiovascular system, and musculoskeletal system. The classic triad often observed is hyperactivity, hyperpyrexia, and hypertension. These symptoms reflect the drug's powerful stimulant effects and should raise clinical suspicion of overdose. Now, let's summarize the system-wide effects. In the central nervous system, it causes stimulation, leading to tremors, restlessness, and agitation. Cardiovascular effects include palpitations, chest pain, tachycardia, and hypertension. In the muscles, you might see fasciculations, rigidity, and even rhabdomyolysis in severe cases. Gastrointestinal symptoms like vomiting, diarrhea, and cramps are also common. And psychiatrically, amphetamine can trigger confusion, mood swings, irritability, or even panic attacks. These symptoms together help identify amphetamine toxicity both clinically and forensically. Chronic abuse of amphetamines can result in a toxic psychosis, often characterized by paranoia, hallucinations, delusional thinking. These psychiatric effects may cause the individual to act on delusions, sometimes resulting in bizarre, aggressive, or violent behavior, including suicidal or homicidal acts. At autopsy, amphetamine-related deaths often lack specific findings. However, in some cases, cerebral or subarachnoid hemorrhage may be observed, typically due to drug-induced hypertension. Thus, diagnosis relies heavily on history, clinical features, and toxicological analysis. Death due to amphetamine alone is uncommon. When it does occur, it is usually from one of several complications, such as intracerebral hemorrhage, acute heart failure, severe hypothermia, renal failure due to rhabdomyolysis, or behavioral violence either self-inflicted or inflicted on others. Hence, in forensic toxicology, interpretation must consider not just toxicology reports, but also clinical signs, behavior before death, and scene findings. Okay, here's a quick recap. Amphetamines are potent stimulants with both medical and abuse potential. Their CNS effects may result in acute toxicity, and long-term use can lead to psychiatric disturbances. Methamphetamine is stronger and more dangerous. While deaths from amphetamines alone are rare, they often involve complications like heart failure, brain hemorrhage, or violent behavior. In forensic cases, amphetamine-related deaths demand a thorough and multi-angle interpretation, not just from lab data, but also behavioral and situational evidence. Thank you for watching this video on forensic toxicology understanding amphetamine. I hope it has helped clarify the mechanism, clinical effects, and forensic interpretation of this important and widely abused drug.